Hi, good morning, everyone. I'm Dr. Ranjan Modi. I am a DM cardiologist at Indraprastha Apollo Hospital, Delhi. Today, we're going to talk about a very important topic which has been concerning most of the people in India and around the world. We've been listening to so many stories of actors, singers, TV personalities who have been having acute coronary syndromes or heart attacks during a performance at home or even during exercise and succumbing to its complications. So today we are going to talk about the fact that cardiac arrest in young or acute coronary syndrome MIs in young, why and in whom can we prevent? So before we start this, we need to understand what do we mean by an MI or a heart attack or a cardiac arrest. The heart is made up of muscles. These muscles are needed for the heart to be able to pump blood to the entire body. Now, these muscles are supplied by vessels which we know as coronary arteries. These coronary arteries supply blood to the entire muscles so that they can get their oxygen, they can get their food, they can get their nutrition to be able to function and pump. There are three coronary arteries which supply blood in the heart. These are the right and the left coronary artery. The left coronary artery is divided into the front artery, which is known as the left anterior descending or the LAD, and the back artery, which is known as the left circumflex. So any blockages in any of these three arteries can lead to a heart attack, as the blockage causes complete loss of blood supply to the muscle. The heart muscle is not able to get the blood, the heart muscle starts to die, and thus the heart is not able to pump enough blood, which we call as a heart attack or a cardiac arrest or a myocardial infarction. There are various reasons for these to happen. We all know most of these reasons, which can be divided basically into modifiable or non-modifiable, or which means things we can change and things we cannot change. Things we can change are most of these risk factors, which are hypertension, blood pressure, the cholesterols, lifestyle changes like smoking, alcohol, any drug abuse, obesity, lack of exercise. Now, these are the risk factors which can be changed if we control blood pressure, if we control diabetes, if we bring down our cholesterols to very low levels, if we exercise regularly, if we cessation of smoking, all these can lead to reduced chances of a person developing a heart attack. Most common reason for a heart attack in young is smoking. Reduction of smoking actually reduces the chances of you having heart attack, specifically in young. Now, leave aside these factors which we can change. Let's look at factors which we cannot change. What we cannot change is age. What we cannot change is family history, and what we cannot change are genetics. Now, these three factors are the factors which can lead to heart problems, but they're not in our hand. That's why we call them non-modifiable or factors we cannot change. Another most common reasons for such heart attack in young is very high cholesterols. There have been recent studies and there have been significant literature which has shown that in patients who have heart attacks at younger age, which means males less than 55 and females less than 45, when we start looking at their next generation or their sons and daughters, we find that they have very high levels of cholesterol. Cholesterol just doesn't mean total cholesterol. Cholesterol also means the LDL. LDL is the one which we call as bad cholesterol. And guidelines have changed tremendously in the past a lot of years and has told us that LDL should be kept as low as possible. So if you have patients who are coming with LDLs in young age with 150, 160, the chances of them having a heart problem or a cardiac arrest are much, much higher than a patient who has come with us with an LDL of 100. We need to bring down these LDLs. And the best way to bring down these LDLs is, yes, good exercise, decrease in fatty diet, and medications. There's always been a dilemma in which people start telling us that, once a medicine has been started, it needs to continue. We need to understand why we're giving these cholesterol-lowering medications. It is just not to lower cholesterol. Statins, or the cholesterol-lowering medications, which is commonly known as, not only reduce cholesterol, but they prevent further heart attacks. What we call is they stabilize the membrane, which can lead to a sudden heart attack. Now, it is very important that we continue these medications. The question always patients ask us, my cholesterol is fine, I do not eat outside, I exercise every day, do I really need these medications? So let us understand this. 80% of the cholesterol which is made by the body. Only 20% comes from outside. Now, we need particular kind of enzymes which digest these cholesterols. The 80%, at least the 80% which is made in the body, need to get digested by particular enzymes which are made within the body. Now, in some patients, the production of these enzymes lowers drastically, and even at 18 or 19 or 20 years, the amount of enzyme which is produced by the body is far lower than we expect it to be. Now, how do we increase these enzymes? The best way to increase these enzymes is take these enzymes from outside in the form of a tablet. So once you start taking these enzymes in the form of a tablet from outside, it helps replace the reduction or the deficit of these enzymes which is produced by the body, and just cholesterols can be digested and they can come down. If you look at all these personalities, they all had a heart attack. So now, why did they have? Didn't they have the best nutritionists? Didn't they have the best gym trainers? They did. Now, what was it that caused them to have a heart attack? Well, as we mentioned, these risk factors. Smoking, drug abuse is one of the biggest risk factors for sudden cardiac arrest in young. Also, high cholesterols. A patient who has high cholesterols and is a smoker is at least 3 to 4 times more prone for a cardiac arrest than a patient who has just high cholesterol or who just smokes. So when two factors come together, it is not just additive effect, it's an exponential effect, which means if a 3% rise is there because of smoking and a 3% rise because of cholesterols, it is not just 6, but it's actually a 3 into 3, 9% rise in the chances of you having a heart problem. So we always suggest patients, specifically who have a family history of coronary artery disease or a heart attacks, they should get their regular health checkups. Beyond 20, 25 years, get a regular health checkup done every year. Routine health checkups are available in most of the hospitals. In our hospital, we have a cardiac care health checkup, which includes most of these risk factors, assessment of most of these risk factors. Blood pressures, sugars, cholesterols are assessed. We also make you undergo stress test and stress echo, which tells us how good or how bad your heart is functioning. And also indirectly helps us to assess if there's any kind of blockages which we can expect into your heart. So regular health checkups, cardiac health checkups, sincerely helps in bringing down the chance of you having a sudden cardiac arrest and not being able to reach the hospital. As you grow older, these health checkups can be turned into 6 monthly investigations. We would rather get a health checkup done and know if you are prone for a heart attack and start medications rather than have a heart attack and end up in the hospital. So regular health checkups, reduction of these risk factors, exercise. Now, as cardiologists, we always suggest a moderate intensity exercises, but the frequency has to be more. So if you're doing moderate intensity exercises, which means running, jogging, swimming, cycling, walking, any of these cardiac exercises, and you're doing it 4 to 5 times in a week, it's good enough. We do not suggest people for extensive, severe, strenuous exercises because these exercises can cause a load on the heart and thus can cause sudden these blockages happening in the arteries. So we always suggest the frequency should be more. So if you're doing it 4 to 5 times in a week and you're doing moderate intensity, is better than doing a strenuous exercise once or twice in a week, where we think that, one day today I'm going to put all my heart out into it and I am going to feel better. No, that can actually cause more problems than regular exercises, everyday exercise, every day doing the same cardiac exercise or a different cardiac exercise out of any of the 5, running, walking, jogging, swimming, cycling, so that your heart keeps fit. So it becomes very important, specifically in young, that we understand why this happens, which is the risk factors and your genetics. We cannot change genetics. We cannot change our family history. So if you're prone for it, if your parents, if you're anybody in the family, your brother or sisters have had heart problems, then you are more prone for it, and the chances of you having these heart problems drastically go up. So this is why you can have it. And in whom? Yes, patients who are high cholesterols, patients who are smokers, in them. And prevention is very simple. Just get yourself checked. Just make sure that all these risk factors which can cause them are under control, because they can be under our control. And the ones which cannot be controlled by our family history, genetics, can at least be assessed every year so that we can prevent an undo incident from. So I hope I've been able to clarify why these heart problems happen in young and why they are more prone for it. I'll be open to questions if there are any. So one of the first questions someone has asked is, what happens to a person when he is in a cardiac arrest? See, a cardiac arrest is basically sudden, total closure or obstruction of the coronary artery. Now, most of the times, these patients suddenly present with sudden chest pain, which is in the center of the chest. It is an unbearable kind of a pain, which might radiate to the arm, to the neck, to the jaw, to the back. This generally is because of a total obstruction of the artery. Now, if this happens, we know the patient is having a heart attack. At this stage, all you need to do is make sure the patient reaches the hospital as quickly as possible, or if there's any help nearby, get a medical doctor. Just transfer him to the hospital, and the hospital will take care of it. The doctor will take care of it. But any pain which happens in the center of the chest while exercising or not exercising is actually a sudden cardiac arrest. So someone asked us, as a young adult, how to know that I might have a heart-related issues. Yes. So as we said, get your health regular checkups. Even if you're 25 and above, we don't know how much cholesterol is there unless we get lab investigations done, unless we take your blood and check what is the level of cholesterol in your body. We do not have a clue as how much cholesterol is there in your body and how prone or how risk is there for you to have a heart problem. A lot of people think people who are obese are more at heart problems than people who are lean. Yes, obesity itself is a risk factor, but that doesn't mean everybody who's thin, who is not obese, has normal cholesterol levels. No, we have so many patients we see, they are lean and thin, but their cholesterols are off the chart. So get your regular health checkups done, do a stress test, get your blood investigations done, go see your cardiologist. And if the need arises, start on medications. A pill can save my life rather than get a few stents and risk of losing my life because of a heart attack. I would rather want to take a pill every day. What should be the first sign to notice if someone's having a cardiac arrest? Yes, chest pain is the most important and the first sign. A lot of time patients can also present with sudden onset of breathing difficulties, specifically if they're exercising. Otherwise, the most common symptom is heaviness in the chest, center part of the chest, where you feel there's a large weight sitting on your chest and you cannot breathe. It's like somebody is just pressing you down. That is the first sign. If that is happening to anyone, if there's any radiation to the arm, to the neck, do not wait for it to get to increase in magnitude. Just rush to the hospital as quickly as you can. What is the difference between a heart attack and a cardiac arrest? Okay, So we need to understand, for layman people, cardiac arrest and heart attack are almost similar terms, but for us as cardiologists, there's a large difference. A heart attack, let's assume you have a room. A room has an electrical supply and a water supply. The same way, the heart is the only organ in the body which has its coronary arteries which supply blood to the entire muscles for them to be able to pump. And there's an electrical system which helps provide a stimulus for those muscles to contract. So muscles need both an electrical stimulus and food and nutrition through those arteries to be able to contract. Any stoppage of blood supply in those arteries can lead to what we call as a heart attack, where the muscles are not able to get enough blood supply and enough nutrients, enough oxygen, and they suddenly stop functioning. A cardiac arrest is loss of electrical supply to the muscles. Now, this electrical supply loss can also be because of blockage in the blood vessels, because the same blood vessels also supply to that area for them to be able to function to produce that electrical current. So for layman, a cardiac arrest and a heart attack is something very, very similar. For us cardiologists, there's a very thin line. The cardiac arrest is basically because of loss of electrical activity, which might be related directly to the loss of blood supply, or it might itself be sudden loss of electrical activity, whereas a heart attack is always because of loss of blood supply to the muscles of the heart, so that the heart is not able to pump and body does not get enough blood, and that's how the body starts to shut down. How can I help someone if I find out he's having a cardiac arrest? Okay, if you think someone is having a cardiac arrest, call an ambulance. Nearest hospital, do not try and take him far away. Do not waste time on the road. In India, it's very difficult to reach even hospitals because of the logistic problems. Go to the nearest hospital, whichever is there, so that at least you get the first aid. There are medications which can be given, blood thinners which can be given, which can actually help us open up those arteries so that we can save the heart muscle. ECGs can be done by the doctor. The doctor talks to you, finds out what has happened, looks at those risk factors, looks at the ECG, looks at the echo, and then at least tells us if the patient is having a heart attack or not. So if you have anyone who's around you who you think is having a cardiac arrest, do not wait, just rush him to the nearest hospital as quickly as you can. And if you cannot, just call an ambulance. At least let the ambulance people do their job while they're on the way to the hospital. So thank you. I hope I've been able to clear a lot of whys and whom's and what to do's, specifically in today's scenario where we see a lot of these heart problems happening in young. I hope I've cleared a few doubts and I have been able to impart a little more information to most of the people who are there listening to this. I just would like to again reiterate the fact, do not think heart problems only happen in older people. You need to make sure that you get regular health checkups. You go to the cardiologist, get your risk factors checked, get your TMTs and stress echoes done every yearly and in a regular way. It is like just a regular checkup as you do for your materialistic things like cars. Please get a checkup done for yourself so that we know what's happening, how risk you are at of having heart problems, and at least we can negate those risks by proper medications, proper advice.